Hello, I'm Dr. Nidhi Gupta and I'm going to go through medical errors. So we're going to go to how to approach this OSCE, some key principles and then a scenario. So this is a common scenario often failed by candidates. It's not only medical errors but angry patients as well. And the reasons patients can be angry, they've been waiting too long in the clinic or in the emergency department, an error has been made by the medical or surgical team, there's been a delay in diagnosis or treatment.
I'm still waiting, and I've been waiting nearly that whole time.
Oh, it's been 8-9 months.
I think so, yeah.
Oh dear, I'm so sorry to hear that, and I am sorry about that.
I know, at the moment, I think the thing is, it's just making me really anxious because I don't know now what's wrong with me. So anytime,
or they have just received some bad news, maybe from yourself, or that the patient or relative's expectations are not being met. So let's go through some key principles. Ensure you don't become loud and angry yourself. Say sorry. It's okay to say sorry, and you should be saying sorry. It's a common failure point to not say sorry and maybe blame the patient. It's okay to say sorry, but also not admit personal guilt. I'm sorry this has happened to you, for example. But don't just say sorry and then move on. You have to mean it. If it's a medical error, say sorry. I can't say this often enough. And it may not be your fault, but don't blame others. If there was an error, you are a representative of the entire team. You will arrange, if the patient or relative wants it, time with the consultant afterwards. The error will be investigated and the patient or relative will be told the outcome. If it's a medical error, say sorry, but say what you will be doing to fix the error.
I am distraught and I'm so worried, and I'm also contemplating making a complaint because he should be getting better in the hospital, not worse. You've totally let him down.
I completely understand, and I've been through your dad's case notes in some detail to catch up with everything that's going on.
Good.
Can I take a minute to talk through what's happened so far, and we can figure out what we can do next, and I'll do my best to answer any questions and fill you in on what we know and so on.
If it wasn't your fault or your team's fault, you can say, I'm sorry this has occurred, hence you're not admitting your own guilt. So let's go through a scenario. Working in trauma, and Mr. Keane, aged 40, has had a pre-op assessment yesterday, and as part of the assessment you took some blood, and from some other patients as well. Everything about the surgery and post-op management's been explained to the patient. Today you called the lab for the result, but they said you need to take the sample again because they weren't labelled. You have to talk to the patient and phone them up and explain what happened. So the patient will be angry. They've had to undergo a blood test, take time out of their day, and now they have to do it again. They may be worried about the operation being delayed. Reassure this won't happen. And if they say they can't make it at a time you suggest, then say you'll arrange for a convenient time after discussion with the consultant. The patient will be angry, so say sorry. It was your fault, this one. And you have to say sorry. If you don't, you will fail the station. You can sympathise with the patient for causing them further distress. You've learnt a valuable lesson from this, and you can say that you will not do it again. Say sorry again. Make sure you have a plan on how to fix it. Thank the patient and say sorry again.
So there are two separate issues here, I think. One is the fact that this investigation has been delayed, for which I can only apologise on behalf of the hospital for. And the second thing is about whether there is actually something to be concerned about from the point of view of your heart.
Let them know that they can make a formal complaint. It is every patient's right via the PALS service. And say you will let the consultant know about the discussion and document it in the patient's notes. And does the patient have any more questions? So we've gone through how to approach the OSCE, some of the reasons for the scenarios, some key principles, and a common scenario. Good luck.